The views expressed on the following program do not necessarily reflect the views of Money Radio staff, management, or advertisers and do not represent an offer to buy or sell any securities.
It's time for Health Futures with Cypress Home Care Solutions, Bob Roth. This is Arizona's only show dedicated to providing you with expert advice on how to live a longer, healthier, and happier life. To learn more, call 602-264-8009. That's 602-264-8009. Now, here's your host, Bob Roth.
Good afternoon. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and it must be Friday, and indeed it is. We're coming at you live from the Scottsdale Air Park Money Radio Studios, 1510 AM, 105.3 FM, and the World Wide Web, moneyradio1510.com. And if this is your first time tuning in, our show is about how our older adult population can live a healthier, happier life. And how do they do that? They do that by listening here to Health Futures here on Money Radio, and they don't listen to me. It's these incredible guests that I get to bring to the show. So we're coming up to you live. It is June the 3rd. It's hard to believe we're almost halfway through 2022. How can that be? But without further ado, I want to introduce our guests. So I'm really pleased to have in the studio with me, I've got Dr. Tiffany Pankow. She is the Associate Chief Medical Officer of the Honor Health Medical Group. She's a practicing family physician who is driven by a commitment to patient-centered, compassionate care. Dr. Pankow, thank you for joining me here on the show.
Thank you for having me. It's my pleasure to be here.
Can I refer to you as Tiffany?
Absolutely.
Tiffany, it's so nice to have you here on the show. And, you know, I said that you're the Associate Chief Medical Officer of the Honor Health Medical Group. So could you, for our listeners, explain a little bit about the Honor Health Medical Group?
You bet. Our ambulatory medical group is across the entire valley. It's composed of over 70 different locations. We have 29 primary care clinics. We also have a multitude of different specialists, including neurology, cardiology, gastroenterology. We have our physical medicine and rehab, as well as our new integrative medicine clinic.
Wow, you've got a pretty robust offering and really cover all over the valley.
We really do. We spread all the way from Mesa and Tempe over to the far west valley, and we just recently opened our newest urgent care in Fountain Hills.
So, see, I think many of us think about hospitals. We think about the medical offices that are all surrounding the hospitals, but we're not talking about just those hospital locations. We're talking about throughout the valley.
You're absolutely right. So we have some of our clinics that are right on our hospital campuses, but they're also spread out in neighborhoods all across the valleys to make it easier for patients to connect. And part of the great thing about the medical group is that we're all connected under one medical record. So one of the challenges across networks is, did you get the consult letter from my specialist? And how do I get referred to another provider? And it's all connected across the entire valley that way.
Fantastic. You know, one of the things that you did talk about was the way you are set up now with integrated medicine. And if you could share with our listeners about some of the how the practice does work. You're not just seeing a doctor.
Correct. In our integrative medicine clinic, you're seeing a physician. We also have additional modalities that can help to treat patients. So this may include yoga, may include massage therapy, include our mental health providers, dietitian, and others.
Wow. You have a lot there. Definitely. You know, I want to do a deeper dive into some of the work that you guys are doing. But before I do, I want our listeners to know a little bit about you. So, Tiffany, if you could walk us through, I do know that you're a native, but, you know, talk to us a little bit about where you were educated and your path to where you're at right now.
You bet. So born and raised right here in Phoenix. So it's something that's near and dear to my heart, Arizona and the Valley for sure. Went across the country to Virginia, went to University of Virginia for undergrad, and then ended up being fortunate enough to go back there for medical school. Returned to do my residency training here in the Valley at Good Sam and finished that almost 20 years ago now.
Wow. Fantastic. And you've been now part of the Honor Health the primary care group that we're talking about. You've been part of that for how long?
I've been with Honor Health for the last 8 years, and
Okay.
in my current role for about the last 3. And we've really grown over the 8 years that I've been here. So it's been amazing to see the journey and the progress.
I mean, over 400 physicians, 29 locations. That's quite a feat. It really is. You know, one of the things that I definitely want to talk about is, you know, certainly this pandemic and what it has done to our community and to the patients. And you get a chance to see this firsthand because not only you overseeing everything, but you did share with me that you do visit with patients a couple days a week. So what are you seeing out there so our listeners can get a better understanding what's going on?
You bet. Absolutely. I think it's taken a toll on all of us the last 2+ years, and I'm seeing it with my patients in a couple of really important ways. The first is that I've seen people really delay their health care, so they haven't wanted to come in. They have been missing out on their screening. They're not being followed for their regular chronic conditions, and we're really seeing the impact of that right now. We're seeing some delayed diagnoses. We're seeing people that have not had their chronic conditions treated in the way that they really should be. The other impact that's been on all of us is the toll it's taken on our mental health. So really the isolation, not being able to be connected with others has really taken a hit. So we're seeing much higher levels of anxiety and depression in our patients, and as well as people turning to substance use to sort of fill in that sadness that they often have. So we're seeing more use of alcohol as well.
And that becomes really challenging, especially with the older adult population, because not only, you know, the alcohol and the fact that they metabolize it a lot different than you and I do, but also the interactions with other medications.
You're spot on. So alcohol can impact our elderly much more intensely, and also the combination with medications can cause some significant side effects that are concerning.
And, you know, taking a deeper dive into the fact that people have not been going out to see their physicians, and a lot of them are dealing with some acute and chronic conditions, and, you know, they need to, you know, be able to stay up on those conditions that they're dealing with, whether it be COPD, CHF, you know, whatever their diabetes. You know, what is your message to our listeners about getting in to see their doctor?
My recommendation is to definitely make those appointments, call right away, make sure you're getting in to see your physician and getting back on track if things have fallen off. And just know that we're here to really address all of your healthcare needs, whether it's that chronic condition, whether it's mental health, or something else.
And, you know, being able to stay connected, I mean, a lot of our listeners, I mean, right now we know there's an uptick in COVID. And we know that we do have a treatment protocol right now, but it does come with some challenges. With you had shared with me before we even started the show. You know, I'm talking about, I think it's called Paxlovid. Did I say it right? Because they always have different names.
You said it correctly.
Paxlovid. Paxlovid. But Paxlovid, you know, needs to be done, and you need to take that early on, you know, just as symptoms start to present. And you need also have somebody just monitor your medications because of the interactions that it could have with the medications.
You're right, absolutely. If people are diagnosed with COVID, whether it's an at-home test, those are good tests to use if you have symptoms and have concerns. But if you have concerns about COVID, do reach out to your physician, your provider right away so that they can see if Paxlovid may be a good treatment option for you, and also to be sure that you're taking it in a safe manner.
And then on top of which, if you're going to go visit any one of your medical outlets, if you would, for lack of a better word, you guys all practice the protocols in place, right? Are you still requiring people to wear masks?
We are. We're asking everyone in all of our facilities to wear masks. This is both to protect other vulnerable patients as well as to protect our staff.
Well, for sure. So, you know, one of the things that, you know, I want to just conclude our first segment, and that is the importance of having an annual wellness visit. And, you know, I know I'm due to see my doctor. So can you at least start it, and we have to pick it up in the second segment, we will.
You bet. So I think an annual wellness visit is a great way to connect, get back on track. Like I said, many people are putting off those screening visits to really have a reset to see what you can do to optimize your health.
Awesome. And it's easy to do. I mean, get in, make an appointment and get in to see your physician, and make sure you have a list of all the challenges and concerns that you have so you can review that with them. You can hear the music. You know, Tiffany, it goes really fast. We got 3 more segments. We got 1 down. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth. I'm really pleased to have Dr. Tiffany Pankow here in the studio with me. She is the Associate Chief Medical Officer of Honor Health Medical Group. We got 3 segments left. Stick around. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and if you're just tuning in, I've got Dr. Tiffany Pankow here in the studio with me. She's the Associate Chief Medical Officer of Honor Health Medical Group. And if you missed the first segment, she did a wonderful job describing exactly what the Honor Health Medical Group does, and the fact that they got 29 locations. They got over 400 physicians that are working in the practices, and they do a lot of integrated health inside these practices. So it's not just primary care, it is behavioral, and you talked about yoga and you talked about massage. I mean, there's a lot that you are offering to consumers that can come to your doctor's practices.
You got that right. Absolutely.
You know, when we left off in the first segment, we talked about wellness visits. And, I want to just not do a deeper dive, but just say, look, we want you not only to come with questions, but it is really the wellness visit is more around prevention, right? It's really talking about how we can keep you healthier and happier for the rest of your life.
It really is. It's the annual wellness visit that's typically covered by Medicare is really a health risk assessment. So it's a series of questions to really determine where you are at risk for your health. So it may look at risk for things like dementia. It may look at risk for falls. It looks at risk for mental health as well, which we talked about earlier and how critical that is. Yes, absolutely. It may include some screening labs. It also can include prevention for screening for cancer as well.
Nice. It's all of that. So we're trying to prevent and make you. It's a wellness visit. That's exactly what it is.
It is. It's about a time to talk about your lifestyle. Are you getting the nutrition that you should? Are you getting the movement and exercise in your life that you should?
And so important. And the most important thing is family history, right? I mean, we've learned so much that family history is kind of like the code that we need to uncrack to figure out how your health is going to be and how do we take care of you so you can live a longer, happier life.
Yeah, I think it's 2 things. It's sort of the DNA that you're brought into this world with, and that is exactly right with your family history. It's also about what we're doing in our life and our lifestyle and how we're taking care of ourselves. So taking care of our mental health, getting adequate sleep, eating healthy, nutritious, lots of plants in our diet, and getting some natural movement every day, finding those things that keep us purposeful in our life. Those are the things that are really going to continue to help keep us healthy longer.
And I would imagine, one of the things that you do is you in terms of fuel and eating, that is so important. So is dietitian part of the practice too? Is healthier eating? I mean, everyone talks about a Mediterranean diet. I'm all in when it comes to olive oil and wine. I mean, that's really good. The beans and everything I could do without.
Right. Yes, absolutely. We have dietitians as well. I think that's a really important piece is talking about the nutrition. And you're right, the Mediterranean diet is one that probably gets the most hype that's out there. I think really focusing on those whole foods is really helpful, avoiding things that are processed, limiting the sugar. And you're right, the olive oil is great, but we do need to get those fruits and veggies in there as well.
No doubt. And you did touch on exercise, and that's really important. And certainly, one of the things that we see in our older generation, not so much this generation, but the older generation was very sedentary. Mm-hmm. And I think, one of the things that you would probably prescribe, Tiffany, is to be active, to be moving, and to make that a part of your daily life.
Exercise is so key for so many reasons. It's helpful for our joints. So we talk about arthritis, and one of the best things to do to help our joints is to continue to move in ways that you can speak with your doctor about what's the right way of movement and the right type of exercise if you do have joint pain or back pain or other limitations to mobility. But moving is really important for that. It's helpful for our mental health. It's just a tremendous thing to keep in our lives. And especially as people age, the risk of of falls is a really big challenge for folks. And the more you can strengthen those muscles, the more you can improve your balance, the better off you'll be in terms of preventing falls.
And we also know that there's heart benefit to movement, right? And I've learned this, and I shared this with you off the air, that I spent 10 years on the board over the Banner Alzheimer's Institute. I've learned that heart health and plaque in your arteries can lead to plaque in your brain too. So I mean, being active and improving your heart health improves your brain health as well.
Yes, our brain health is definitely affected by our lifestyle, by the things we put in our mouths, the nutrition that we have, and definitely the exercise as well. It really, the great thing is those things are good for every part of our body, can help, as you mentioned, decrease your risk of cardiovascular disease, decrease your risk of dementia, and help to treat or prevent diabetes.
So I want to start on this topic, and I know we may not finish it before halftime, but I want to talk about medications. And, certainly we talked about the older generation being on a lot of medications. My father takes over 30 pills a day. It's incredible. And he's been on the show. My father's name is Sheldon. He's affectionately known as Noodles. And Noodles has got not only 9 lives, he's got 18. And I keep telling him he got double, and he's on the back 9 right now. But, I mean, the medications that he takes and the importance that people need to understand about medications and its effects on the bodies. What can you tell our listeners about medications?
Well, first of all, I can say medications can be vitally important to our health and to treatment of diseases. But I think we also have to be very careful for folks in the way that they use their medication. I think the most important thing is to keep an accurate and up-to-date list of your medications. It's really important to know all the medications you're taking, the dosage of the medications, and really the reason why you're taking that medication. That can have a huge impact for your health.
You should always have it with you, too. I will tell you, with my dad and my mother, who will be gone now 20 years this year, we used to laminate it and put it in her wallet, and my dad carries it on with him. I mean, God forbid something were to happen. This way, anyone that was responding to an emergency can see what medications they're taking.
Agree. That's critically important to have it with you.
No doubt. And certainly the interactions of medications with other medications, and like you said, for those that are using substances to cope with some of the challenges that we've dealt with this pandemic, is definitely going to affect those medications.
You're right. And it's important to continue to reassess the need for the medications over time, talking with your physician about all of the medicines you're on and seeing, are there ways that you may be able to go off of some of these medicines if they aren't serving a need currently.
I'm so glad you mentioned that, because so many of our clients take so many of these medications. And, I've had people try to intervene. We'll just say they're third parties that come in and start to take things away. And I always, I'm like, wait a second, we need to check with a doctor. And sometimes this type of event needs to be done in an inpatient unit rather than at home, because you're going to take some of these medications away and you may have a really bad side effect, or you may have a very bad outcome.
You're right. Some of these medicines really have to be tapered off appropriately. If they're stopped cold turkey, they can cause some significant problems. So it's best done under the supervision of a physician, perhaps with the help of a pharmacist even as well.
And I would be remiss in not bringing this up. I mean, listen, we all talk about the pandemic and that being COVID. I believe that the real pandemic is aging, and we can talk about that in the second half. But the other pandemic that was happening prior to this was opioids. How much are you seeing that in your practice, and how much have you seen an uptick in that since the pandemic?
We have nationally absolutely seen an uptick in opioid use and opioid overdoses. So I think it's a really important topic to bring up. I think there's a lot that has been done in the community, a lot within Honor Health specifically, to be sure that we're using these medications in a safe way.
Yeah, and the thing that really concerns me most is something you talked about, tapering. And these drugs are great, but they really didn't teach medical professionals on how do you taper someone off of them. Have we gotten any further on that? I mean, have we really learned how to bring people off of those opioids? Because I think that's the biggest challenge we run into.
I think it's really about partnering with our patients. It's getting additional support if needed from a specialist. We have an excellent pain specialist at Honor Health, and even including some of our behavioral health specialists as well, to be sure that we're taking people off and addressing their pain at the same time.
So important, absolutely. And then, the last thing I want to bring up, as we get ready to take our halftime break is with the pandemic, I know you weren't allowed to see, or a lot of patients weren't coming in. You guys gravitated to telemedicine, I would imagine, and you were able to do visits.
We did. We continued to do visits via telehealth almost immediately. So we were there to take care of our patients. And it's been a hybrid throughout the pandemic. Many of our patients still want to come in and see us. They feel that's a really important part of their health. And so we want to be there for them. We also know that transportation and for other reasons, people may want to be in the comfort of their own home to have their visits. And so we're really working to make sure that's available to our patients in the future as well.
And, I think patients get so much out of visiting their doctors, especially when they come in to see, their family practitioner, because not only are they visiting with their doctor, but they're visiting with the staff. And sometimes those are the only people they see. So, I mean, it is important for them to see them in person. But I've also heard from other physicians that it's been really nice to visit with patients in their home because they, meaning the patients, get a chance to show their doctor where they live. And a lot of the doctors have said, I've met my patients' dogs and their cats and really gotten a chance to know them personally. We got halftime coming up here. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth. I've got Dr. Tiffany Pankow here in the studio.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You, and I'm your host, Bob Roth, and we're in our second half here. And if you're just tuning in, I have got Dr. Tiffany Pankow here in the studio with me. She is the Associate Chief Medical Officer of Honor Health Medical Group, and we have talked about a lot of different things. And if you've missed that first half, go up to our website at cypresshomecare.com. Click on the media button. Third button down is radio show. You'll catch this one and many, many more. So, Tiffany, we talked about medication. I want to come back to that because, especially with older adults, medication is such a big, big deal. And, I want to talk about med management and I learned a little something about the American Geriatric Society beers criteria, and beers not like microbrews or national brands. Can you walk us through a little bit of this?
You bet. So the Beers criteria is a list of medications that may be higher risk in our elderly patients. So this may be the side effects that may be more potent in our elderly. It may be that they're metabolized differently as we age. Our metabolism of medications changes. They may be a higher risk for side effects with other medications. So it's just really important just to be aware of this list, something we as physicians look at very closely when we talk about medications. And it's something that we use our medication management, our pharmacists frequently to assist us with this. So we have a very robust medication management program with Honor Health, and they help us in a couple of different ways. So especially when patients have polypharmacy, which is on multiple medications, 20, 30 medications, they can help to look and make sure that those are being done safely. Can any of these be tapered off? Are there side effects that we're seeing from these medications? They also can help us to manage things like anticoagulation. So people that have to be on long-term blood thinners, they really can assist us with making sure that's done safely with a point of care testing of blood for that if needed. And they also are tremendous in helping our diabetic patients, making sure they're on the right medications and really understanding how those medications work.
So important. Absolutely. And when you sit here and you talk about medication management, if you would, so many of the ER visits that are happening with older adults are because of medication mismanagement. And it's so important to really get this down. Now, they have these Medisets, and I am sure you're a proponent of having your patients make sure they put their pills in the right boxes and take them in the right doses at the right time, and making sure they keep that regimen up to date.
Those pill boxes, I think, are really helpful. Helps to make sure you don't forget a dose or forget and take a dose a second time. I think it's really important to have those and use those. We talked about the medication list earlier, and really knowing why you're on these medications, I think, is really important too.
And, people, there are a lot of people that take Tylenol and Advil like they're vitamins, and they'll take them multiple times a day. And, the thing that people need to understand, especially with Advil, to your point, it's an anticoagulant, and if you are on anticoagulants, you've just thin your blood even more. So it's real important to know that, and also to be able to take food with it as well. Because I was one of those people who used to take a lot of Advil and didn't realize and I'm going back many years, didn't realize the effects it could have on my organs if I wasn't eating food at the same time.
You're right. Just because something's over the counter doesn't mean it's entirely safe. So it's really important to talk to your provider about those over-the-counter medications. You brought up Advil or ibuprofen, which can be tough on your kidneys. It can be tough on your stomach and put you at risk for ulcers. And as you also said, the interaction it can have if you're on a blood thinner, it can increase your risk for bleeding significantly. So important to talk about those. And we mentioned the Beers criteria a few minutes ago, and there are some over-the-counter medications that are on that list, including Benadryl, which is also called diphenhydramine. It's also given in a lot of the sleep aids over-the-counter, and we know many people that are over 65 have challenges with sleep, so it's a pretty easy go-to to start taking all of these PM medications, not realizing the interactions it could have with other medications or how it can impact the risk, particularly for falls in folks at night if they get up in the middle of the night.
Or if they get behind the wheel and are driving a vehicle. That's pretty scary. And it's not uncommon for someone to fall asleep behind the wheel.
You bet.
Yeah, so those things happen. Talk to us a little bit about some of the this stuff that is not regulated by the FDA. And you talk, a lot of people are going to these health stores and taking supplements. And, what is your recommendation to our listeners about taking supplements on top of taking these medications?
Well, many of the supplements out there, as you mentioned, are not FDA approved, and they're not regulated the same way that medications are. They often have claims that are not really substantiated by rigorous studies in the way that our controlled medications are, the ones that are regulated by the FDA. There may be many times that supplements can be appropriate, but I think it's important to do it with the consultation of a specialist who understands what those supplements are there for, how they can be of help, and how they might be harmful to you. Some supplements are also what we call USP verified. That means that they've been verified by an outside source. So when I recommend a supplement, I recommend those. That ensures that you get quality. That means that what they say is in the bottle is actually in the bottle, and it's been checked by somebody else. So that's kind of what I look for with supplements. But I think it's important to be doing it in consultation with somebody who really understands what the supplements are doing.
No, great advice. I appreciate that. Before we end on medications, is there anything else you want to leave with our listeners? Because there's so much more I want to talk to you about. But medications, like I said, is one of the number one reasons why older adults do end up in the ER.
I think one thing is just being honest with your provider, your physician, with the medications that you are taking, or if you're not taking them, if for there's some reason you can't take it, they're too expensive, you're having a side effect, but you don't want to admit you're not taking it. It's really important that we know if you are taking your medicines.
And are you able to help those patients who say that, look, we all know pharmacy drugs are very expensive for older adults. And we have a lot of older adults that are living on fixed incomes and, in a lot of cases could be spending up to $10,000 a month on their drugs. And they're making decisions on food, rent, and medications. Is there a resource that you are going to or you suggest to patients? Because obviously we want them to be able to take all of that in. We want them to have a roof over their head. We want them to be able to eat their meals, but also take their medications and not sacrifice taking that.
You're right, and there's so many things that impact, and we really hate to have somebody have to decide whether or not they can afford groceries that week or whether they can afford their medications. So we do offer many ways that we try to assist with that as much as possible. So we have care coordinators with our primary care offices, and they may be able to help patients to resources. Many of the pharmaceutical companies do offer medications at a reduced price, but you do have to apply for that. So they can help you with those resources to be able to get that. And then our medication management program that I mentioned to you earlier is really helpful in helping people along those paths. Sometimes there may be a cheaper alternative that if you just realize that that one's too expensive, there may be something we can give that is just as safe and just as effective, and we don't know that unless you let us know.
And that's so key, because once a patient leaves your practice, they get their prescription and they go to the pharmacy and they get this big number. They need to know, they need to just go back to their physician and say, hey, is there another drug that you can recommend? Or maybe even ask the pharmacist, and the pharmacist can go ahead and contact you and say, is it okay for us to use this brand versus that brand?
Yeah, we love to collaborate with our pharmacists. We also know that some pharmacies may have the medication at a cheaper rate. So it does pay sometimes to check around to see where they can be found a little bit cheaper.
So true. It really is. So as we get ready for leaving the third segment and getting into the fourth segment, I want to just tee up our last segment, and I want to talk about advanced directives. So the importance of advanced directives, especially with older adults. What are you seeing? Are you seeing more and more people having these plans, or you're seeing that, hey, you don't have these, you need to put these together?
A little bit of both. I'm seeing more people thinking about it, and I'm still encouraging others to get on it. I think it's really important.
All right, so there's a little tease with Marshall Tucker taking us out in the third segment. You're listening to Health Futures, Taking Stock in You. My name is Bob Roth. I'm your host, and I'm really proud to have in the studio with me Dr. Tiffany Pankow. She's the Associate Chief Medical Officer of the Honor Health Medical Group. Stick around. We're going to be talking about advanced directives and more in our fourth segment. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth. And if you're just tuning in, we're in our fourth segment, and I have got Dr. Tiffany Pankow here in the studio with me. She's the Associate Chief Medical Officer of the Honor Health Medical Group. They have 29 locations across the valley, over 400 physicians. And if you missed the first three segments, they were awesome. And you got to go listen to them if you missed them. They're up on our website at cypresshomecare.com. Click on the media button. Third button down is radio show. You'll catch this show and many, many more. So, Tiffany, when we left off in the third segment, we teed it up talking about advanced directives. And I want to really talk about the importance of these in planning as it relates to health care for yourself and or your partner, and how important it is. So tell me, you have a different stance than I wouldn't say different, but it is a very important part of your practice to have these conversations with your patients.
It is, and I think it's really important to set aside some time to be sure you're covering this in an adequate way. Something I recommend for all my patients, regardless of their age. I think it's really important to have your wishes known to your family and to your loved ones, and have it written down so it's easy to access and easy for healthcare workers to know what your wishes truly are if you have an event that would require the use of these.
And it really is amazing how many people, if they just would have these conversations, and it's something that people put off. They're like, they don't want to have this conversation, and it's not a one-time conversation. And I've talked about it here on this show. It's something that you have over and over again with your loved ones to really talk about what those wishes are.
You're right. It changes over time too, because our conditions change over time, and maybe the way we look at life changes over time. So I do think they're important as ongoing discussions, and I've had them with several of my family members who really just want some guidance on how do we go through this, how do we go through the process, what do we need to think about, what do we need to talk about. So I think it's really is a really good thing. I'm glad we're speaking to it today.
Well, what's interesting too is that you talk about changes in life, and I've seen, and maybe you have as well, where partners are no longer partners, and all of a sudden, one of them gets ill, and the ex-wife or the ex-husband is the medical power of attorney, and they're the ones making decisions on someone's life. That's a big deal.
It absolutely can be a big deal. So I think it's something to think about when you do have a change in your life, just like you may be changing other things. Think about those advance directives. Think about who your healthcare power of attorney is, who is on your communication consent that would allow us to speak to somebody on your behalf.
And you also have to think about where the documents originated from, because each state has different laws. And, I know in the state of Arizona, we have both a durable medical power of attorney and a durable mental power of attorney, and not every state has that. So you could be technically incapacitated but still physically have your health, but you're not able to make a decision, so the medical power of attorney could kick in.
You're right. Every state is different, and you can get more information online about this at the Arizona Advanced Directive Registry. They can give you some additional information on there. There's documents there that you can download to use as well. Many of our offices also have those documents, so you could go over them with your providers.
You can also go to the Secretary of State office too, or their website, and they'll give you guidance too, and also the Arizona Attorney General's office. So I mean, we have had a big campaign to really push for this. I don't have the data point in front of me, but the last 6 months of one's life is a lot of times older adults is used to use heroic means, and we're using a lot of those Medicare dollars that person that is using, or we are using medically heroic means, didn't want in the first place, but wasn't able to really describe what those wishes were.
You're right, and I think often people think about advanced directives only around like a diagnosis of cancer, and that's when people start to think about it. But there are so many other conditions that can affect your quality of life and may determine what type of heroic measures you may or may not want, and what kind of life-sustaining measures you may or may not want.
Well, and listen, I've seen it firsthand where somebody's wishes were to really not use heroic means, and then other family members being in the room saying, no, we want you to do this. So it's important for you to leave that roadmap. It's a gift that you are leaving your family.
You're right. It's an absolute gift, because it's much easier when you're in the moment of stress and potentially heartbreak. If you're trying to make those decisions on behalf of somebody else, it's so much easier to know clearly what they would want. So you're not having to decide. You're just following their wishes.
So I made it very clear to my wife, Susie, that she's to trip on the cord and unplug me if I'm in that type of state. We've talked about a lot of different things here today, and Dr. Tiffany Pankow, I really appreciate you being here in the studio. And I want to ask you, is there a question I haven't asked that you think would be one that we should cover here in our segment? Or is there some lasting comments that you would like to leave our listeners?
Well, as a family physician, I'm a huge advocate for having a strong relationship with your primary care provider. I think they're kind of like the quarterback on the team. They're the one who can review all of your different medications from all of your different specialists. So, of course, that's kind of where my heart is making sure you have that ongoing relationship with a primary care provider. And they're the ones who can really help direct you to the specialist that you need all across the organization. There's so many things that are available, and I think it starts with having a really strong relationship with your primary care.
And not only a strong relationship, but an honest relationship too, because there's so many things that people are doing socially that could affect their health. So I mean, you need to have those type of discussions with your primary care physician.
That honesty is really important, and to know that what you're talking with us about is confidential, and we're here to support you.
If somebody wanted to learn more about the practices, they can go, I got it right here. They can go to honorhealth.com, or they can call 623-580-5800. Dr. Tiffany Pankow, I can't thank you enough for being here in the studio with me. What do you got planned for the weekend? Anything fun?
I'm heading up to the mountains, up to my happy place. So later today, I'll try to get out of town up to the cool mountains.
Nice. Yeah, it's hard to believe summer's almost here. I mean, really is. I mean, and we have been so lucky. I mean, to think that these last couple of weeks, it's only been in the 90s.
We've actually had a spring.
I know. And you know what? What's really interesting is my Palo Verde trees in my neighborhood, in my house. I mean, I don't think I've ever seen those yellow blooming flowers last this long. I mean, they have been on the trees for at least a good solid month and a half, 2 months. It's crazy.
Yeah, it's been a beautiful spring for sure. Allergies have lasted a little longer this year, unfortunately, but it's been great to have a spring.
And I'm sure you're probably seeing some of that in your practice.
We do.
Well, listen, I can't thank you enough for being here in the studio with me. Make it a great day. Have a great weekend. We'll be back next Friday.
There's no place like home. You've been listening to Bob Roth's Health Futures. If you have questions about your own or your loved one's future health care, call Cypress Home Care Solutions at 602-264-8009. That's 602-264-8009. Or visit cypresshomecare.com. Be sure to join Health Futures with Bob Roth every Friday at noon, right here on Money Radio 1510 and 105.3 FM.